Hey, everybody. Welcome to In the Know with Nina. I'm your host, Dr. Nina Crowley. I'm the Director for Clinical Education and Partnerships at SICA, where we partner with healthcare professionals and clinicians to offer body composition solutions. Today, I'm so excited to be joined by Kim Tirapelle, Bariatric Sports Dietitian and podcast host of the Active Bariatric Nutrition Podcast. So Kim and I have been in the bariatric surgery space for decades, we can say now. And there's so much that we know from people who've had a surgical procedure that we can really apply to those on medication or even those doing lifestyle interventions. So I really wanted to talk to Kim about her focus on active clients and even just the language around that I love. So I know that we're very aligned with a lot of our philosophy. So I'm excited to have you talk with us today.
Well, thank you so much for having me. I'm excited.
So I know I was just peeking through some of your last episodes. I really love the focus that you have on the patient-centered approach and, really modeling everything to the patient that you have in front of you. So it's not a one-size-fits-all approach. We get a lot of questions in the body composition realm about we're finally getting people away from it's just about weight loss, which is so exciting. But really people are starting to want to know what dose, right? Like how much protein, how much resistance training, how much strength training. I don't feel like that gets talked about enough. So I really kind of wanted to pick your brain a little bit to see what your active clients are doing and how do you work with them to sort of help them meet their goals?
Yeah, no, it's a great question. I think, now that with the GLP-1s coming also to the forefront and us really moving more towards preserving muscle and strength. And I really love that focus of, hey, let's stay strong. Let's try to maintain our muscle as we go through, rapid weight loss phase, whether that's after bariatric surgery or whether that's going through, utilizing medications. I think now we can really start to see some positive body composition changes that don't just look at the number on the scale, which we know is just so one-dimensional. And something that I have focused on for years is just we're trying to move away from just that one number as the outcome measurement determining whether, this has been a good intervention or not. And so I think now that we're getting a little bit more information as to what amount of protein, strength training is important, all that. And so, for many years, we've always kind of used that, the RDA was that 0.8 gram per kilogram. And what the research has shown is for folks that are then wanting to maintain and or gain muscle mass, especially when they're in a caloric deficit, they do need more protein. And so I recently had Dr. Stuart Phillips out of McMaster University on my podcast, and he's a real expert in the field of protein research and metabolism. And, he talked a little bit about that 1.2 gram per kilogram body weight is really kind of the place where we should begin from for protein, and then moving up to maybe 1.6 gram per kilogram. And then for those that are really seasoned and more experienced bodybuilders that really want to continue to see additional muscle gains, you can even go up to that 2.2 or about 1 gram per pound. So really where I start with my clients is we look at that, 1.2 gram range, because of course, after bariatric surgery, they're limited in what they can eat. So, we can throw out all these numbers, but if they can't consume it, out of the gate, you have to start with where they're at. And we, utilize strategies to help build that protein over time to where it, helps them to see some muscle gain.
I always laugh too and talk about how, in our world of dietitians, sometimes we get really focused on numbers and recommendations and even just grams per kilogram. Like my brain does not think in kilograms. So for what would an average patient maybe be? And what does that look like for actual pounds? And then how much of actual protein? Like what does that kind of look like in a day for them?
So it might be, for someone that's, so 1.2 would be about 0.5, 0.6 gram per pound. So if you take your weight, you divide it by, in half, that would be about the amount of protein that you would aim for in a day as your kind of low end of the range. And if you, the high end of the range would be the 1 gram per pound. So if you were staying in that range there, you would be, in a place where that's going to help with stimulating muscle protein synthesis and provide enough protein to, make you feel more full, allow you to recover properly from workouts. And so for someone that's 150 pounds, that might be 75 grams in a day, 75 to 150 grams in a day. And that might just look at, when I'm working with folks, one of the big things is, again, we're meeting you where you're at, what can you tolerate, and how does that look in your life, right? So we'll look at, their eating patterns, how can we add or optimize their current intake. It's not about taking away. And I'll also say this, we oftentimes get overly focused on protein And we get so focused on it that we forget about the other macronutrients that are important for movement, like carbohydrates and fats. And so I really focus on balancing the plate. But we do start with protein.
Yeah, I remember from my work as a dietitian with a bariatric patient population, it almost started to feel like we talked about protein like it wasn't a food, and it was like a thing just to get, and it took on a weird place. So I totally see that, where even now, I mean, there's been a lot of talk about all these protein enhanced foods and things that would otherwise be a snack food, adding protein to that. So there's a lot of thoughts on that. I really, again, appreciate where's the patient at? What do they like? What do they, what's their lifestyle? Because I don't think we can be all or nothing with these are all bad foods and these are, acceptable, approved foods. I think that just creates a really toxic kind of dichotomy that doesn't help anybody.
Right. And I'd add to that too, which is, we get focused on these numbers like, dietitians do oftentimes, but for the folks that are going through, whether they're on GLP-1s and they're having that real suppressed appetite, or they might be having some of the side effects of maybe having, because they're feeling full longer, they just don't feel hungry, or they may feel a little nauseated. It's hard. And when you say, oh, you need to eat X amount of protein, 100 grams, and then you're not able to do it, you get that kind of feeling of, I didn't do it, and it's like,
Right.
I again, like I always say, I go, okay, where are we at right now? Is there an opportunity that we can, change it in some way, whether that's up or down, and we see how we go. And there's no perfect, you have to hit the same number every single day, because everybody has a different tolerance. And so again, it's all about finding where the starting point is and seeing where we can go.
I love that. So for somebody who's, maybe I wouldn't say regular, but someone who's not an athlete or not doing a big amount of exercise, moving from that to maybe a more athletic or, highly fit category, do you see the need for a big jump in calories and protein? Like, what does that look like and how do you assess it?
Yeah. So again, what I always do is start with where we are, and we will take a look at current intake and take a look at how they're feeling. Do they have good energy in their workouts? How are they recovering? Are they sore for 5 days? They're just feeling like, man, I just cannot seem to get back to normal. Usually those are keys of underfueling, right? For the amount of movement that they're doing. So based on where they are, with someone that's had bariatric surgery or that are on GLP-1s, their calories are lower than the average person, right? And that's okay. So we have to start with where that number is for them. And then where can we maybe add in some additional nutrition? Maybe it's just adding in an additional snack before the workout that's going to incorporate some carbohydrates so they have a little bit more energy to draw upon in the workout. Or it might just be, hey, let's take a look at your meals. Are you going long periods without eating, especially around the workouts? That can oftentimes make us feel a little bit less, energetic in the workout. We don't get the most out of it. And so in general, I would say as they make increases in their movement, usually we do have to increase overall calories, carbohydrates, proteins, fats, etc., because the body needs that fuel to be able to do the movements, right? And also to recover. So yes, the answer to that is just yes, it's going to be highly individualized as to how much more that they will need. And the strategies for where we're going to fit that in, again, will be person to person.
Of that. And then thinking about how you're monitoring how they're doing. I'm assuming you're seeing virtual clients, or are you seeing them in person as well?
Yeah, I do all virtual, actually. Yeah, all virtual, one-on-one.
So do you connect them with a provider that can help look at body composition, or how does that end up looking? Because I know, I've listened to your podcast. This is a big priority. So I know that's a big part of the conversation.
Yes. So when we are looking for body composition changes, I'm really a big advocate of trying to move away from that scale number, because again, we're all kind of focused on this, bariatric surgery at, when we first started. I've been a dietitian since 2006, and it was BMI, and it was, just how many pounds did you lose? How much % excess body weight did you lose? And I'm so glad that we're now moving into more focusing on body composition, and companies like Sika that have highly accurate measurement tools that people can utilize to really get data in real time and trends over time, which is something that I really focus on, is how are we trending? Is it trending, is your muscle mass trending upwards? Is your body fat trending down? Whatever that is for each person. But I do encourage them to get body composition testing done at the beginning of working together, and then periodically, usually every about, 8 weeks, 12 weeks, if they can. If every 3 months is okay, that's fine. And usually if their doctor's office has like a Sika tool, or other folks will utilize like in-body scanning or other bioelectrical impedance measurements is usually what they will utilize.
Yeah, I think it's important. I think the trending is key. One thing that we've done recently that I've loved, this is something I've worked on for over a year, is to try to combine the idea of here's your body comp at the single time and then trending over time. So we have a new tool called Treatment Tracker.
Oh,
So if you
that's
do
awesome.
have people who bring you a Sika, you could ask them if they've seen it. It's basically where the clinician will add in their treatments down at the bottom. It's building out a graph over time. So you can see like, hey, I'm on this medication or this surgery or, this nutrition or fitness plan. And you can see what that is on the bottom of the graph while you're looking at their body comp data change. So it's like really that it's what I always wanted as a dietitian
Yes.
was like, I could always remember the surgery date, but how many months ago was that? And, this way we're looking at it all together. We can see, hey, when you started on this went down or up and let's pivot in
Absolutely.
real time, like you said. So that's been a really fun tool. And I think there's so many more, things we can do when we listen to our, clinicians and we listen to our patients about how could this data better motivate them? Because it's
Absolutely.
also data is not alone the thing that gets people to change, right? It's part of this sort of counseling relationship, the comprehensive care. I think we're in an interesting place where people seem to think they want just more data, but really that kind of sweet spot is when you pair the data with all the other counseling and care that we can find.
Right. Strategies and implementation as to how to utilize that data to move it in whatever direction that might be that you're aiming for. Yeah.
Yeah. And so another thing I love that you do too is really combining not just the nutrition piece, but the exercise stuff. And so we know patients and folks who've had obesity their whole life, may not feel all of them comfortable in an exercise setting. So how do you bridge those conversations or get
Yeah.
them, thinking about even just the old idea that women don't maybe want to build muscle too much, right? Like I don't hear that as much anymore, but I don't know, is that still a barrier to some?
It is to some. I think it's for folks that really, have minimal experience in the gym. It just wasn't something that, they had, as part of their life, whatever that might be, in terms of maybe they never went and lifted at the gym, or maybe they used to go and it just felt intimidating and they thought it wasn't for me, And so when we talk about changing body composition over time, utilizing the tools that we have now in terms of whether that's bariatric surgery, GLP-1, the flip side of that is we do want to maintain musculature as we lose body fat. And so resistance training is so important for that. And really, just lifelong, it's important for our overall health, our overall ability to stay functional and be able to move as we get older and stay healthier longer, prolonging our lives. It's really important in terms of maintaining that muscle. So, resistance training, I think I do agree with you. I think that the view around, especially in females, is so much better. Really, in the last decade, I'd say, I think we've really moved into it's not just for bodybuilders. It's about just, hey, I want to maintain or get a little bit stronger. I want to be able to carry all the stuff around the house or do the things that I need to do in life. And so I feel like our thought process around it has changed. But what I will say still is out there is when folks do begin resistance training, because of course, whether that's gaining muscle mass, whether that's an increase in water retention because you have some inflammation due to those workouts, when we look at the scale number and it kind of trends upwards, it can be upsetting for folks. And so that's still a place where I feel like there's, that counseling, that relationship and assuring people that they're on the right path, despite maybe the number looking like it is going in a direction that you don't want. And that's okay. But that's why I think the body composition really helps to give you that fuller picture so that yes, I'm gaining muscle. This is awesome. This is a good thing. So I think,
Yeah.
that's been part of this transition in the last, I would say, decade or so.
And I think too, it takes, one of the things that I remember never really having a great answer for, maybe you do, or maybe the research has evolved since then, is really how long does it take someone to lay down and put on actual muscle mass? I mean, that's something I know it's of course individualized, but I do feel like there's this idea, we started working out, you started lifting weights to some extent, and there's this kind of expectation that those numbers are going to shift pretty quickly. And it
Yeah.
might be more of a long game, really. I don't know.
100%. Well, first off, I think it's important to realize that you're going to see strength gains before you'll necessarily see muscle mass gains. And especially for folks that are in a caloric deficit because they've, they're utilizing whatever tools they're using, it can take longer than to gain muscle mass because that takes energy, right? That takes calories. It takes generally a bit of a surplus, in fact. It takes increased protein. And so you may not necessarily see those muscle gains right away. It may be, 3 months before we see some, more significant changes in gaining muscle, but you will get stronger. And what I always tell folks is, hey, that's a benefit. I mean, you're changing your body in the fact that you're able to move, lift, push, pull more weight. That is a good thing. So, reiterating that those strength gains, that's a positive. That's we're moving in the right direction. And then over time, that long game, like you mentioned, is where you're going to see those more, bigger changes in terms of gaining muscle.
Yeah, the strength and function part is very important. I'm hearing a lot more people and seeing a lot more research on wanting those numbers involved too, and not just the mass, but also, how it functions. So how do you measure that? Do you do grip strength, or what are some of the tools that you use?
So I don't work personally with my clients one-on-one with their lifting. That is usually, I leave that to their, personal trainers or their programs, but we do discuss that in terms of how they're feeling, how can we change their nutrition to help optimize those lifting sessions and so that they get more out of it. So I'm more focused on that nutrition, side of how do we get more out of the workout? How do we recover better? So that when you do go and you are, you're doing some 1 rep max, you're pushing yourselves to see how much stronger you're getting over time, you're getting the most out of that.
Do you see, I've been hearing so much more about creatine. Do you see that in this population as a benefit, or any changes in their body comp? I need to probably dig a whole lot deeper into that topic.
Yeah. So someone that you might consider having, Dr. Darren Candow, he is out of Regina, I think is what it is, in Canada University. He does his research there. He's one of the world's leading creatine researchers. And I chatted with him, gosh, it's been about a year or two now, but creatine really does help increase strength, power, lean mass. Now they're looking at it even more for brain health, bone strength, health, and so forth. So looking more at that neurological side too is important. And they're looking at creatine across the lifespan. So from adolescents all the way up to the elderly, they're finding that creatine can be helpful in improving all of those areas, which is exciting. So in the space that we're in, where folks are, they're going through a rapid weight loss phase, now they're wanting to change their body composition to gain muscle, creatine can be a very helpful supplement. Of course, you can't just take creatine and expect to see results, right? You still have to lift, and you still have to be eating properly and, taking in adequate calories and protein. But it can be that, icing on the top of the cake, so to speak, which is helping us to provide an energy source to your muscles so that you can basically create more ATP. That's what creatine does. And it allows you then to push a little bit longer, harder, so that over time you're seeing gains. So creatine is the world's most studied supplement. It's very safe across the lifespan, and it's definitely, I think, an important option that you can consider once you have addressed those basic components that are important for muscle gaining. It can be an important supplement to consider.
Oh, great. Yeah. And I think that's an important part to say too, in addition to all of that, it's not working if you don't do the other components.
Correct. Yes.
We love a good add-on, a pill, and forget to do the other stuff sometimes.
100%. Yes. And, I think what's important too, they're looking at dosing, do we need more for bone or brain health as compared to just for strength and power output? Mm-hmm. And so again, it's an exciting area because I think now with, bariatric surgery, with GLP-1s, there's more and more folks now saying, okay, I want to change my body composition. What can I do with my nutrition or supplementation? And so it's an exciting time because we're getting a lot of good, more research studies in all of these areas, which is helpful because that's what we want to rely on, research.
Yeah. The other thing I wanted to kind of, talk back and forth a little bit about is maybe what are some other, besides muscle mass, really, like what are some other body comp parameters maybe that you see people talking about? I know, maybe water is one of them that, we can look at with bioimpedance, but I'm seeing a lot of people get really excited when they learn about their visceral adipose tissue. Because we can really connect that to the health beyond, that one really gets beyond the like numbers and mass, and it's really looking at location. And I think that, probably in an active client population is an important one as well.
Absolutely, because that obviously impacts your overall health in so many ways. And so I feel like as their body composition is changing as they are going through that rapid weight loss phase, they're implementing now resistance training or movement, seeing the visceral adipose decrease over time, that's exciting because right away, that you're getting healthier, And so I do have folks that, when they do have more complex and better body composition readings, that's exciting to see. And at other times, I just have folks that'll do, circumference measurements just to see change other than using a number on a scale because they want to see them, leaning out here, because you can't spot reduce, obviously. So again, it's a trending over time. How's my body changing? And sometimes we can be able to cite too, is one side stronger? Has there been an injury that we can focus on? And again, this is where, the experts, personal trainers, physical therapists can help provide advice on movements and things to help balance our body, especially if we see that when we have measurements done. So I will see that a lot as well.
I like that. We have a way to look at the skeletal muscle in arms and legs, each segment or appendage. And that I think is helpful, especially when you're able to get in with somebody who can help you design programs to move differently.
100%. Like, I mean, I've had so many folks that have had injuries. Like I know I had a torn ACL in college and a torn hamstring. And when I do any kind of body composition, I can immediately see my left leg is always a little bit smaller because I don't have the musculature or the strength really is the same as my other side. And that can be helpful. Like you said, if you have a physical therapist or personal trainer who can help you, then that's going to only just help prevent future injuries as well. And to be more balanced is going to help you with your mobility and flexibility for the long term.
Well, listen, this was so helpful to hear, what you're doing, what you're focusing on. I love hearing just all the different ways body composition is being used in practice. So anything else you have going on? I know you have a course, I think, that is new. You want to talk about that a little?
Yeah. So we just finished our first cohort of the Bariatric Strong program, which was a 6-week online program. And it's all about nutrition for building strength and muscle after bariatric surgery, or even for those that have been taking GLP-1s and are just wanting to change their body composition. And so it's really nutrition focused, and it's 6 weeks. It's, bite-sized modules each week. And we have a 1 hour per week live Q&A where we chat, we go over questions. And so it's been great. I really enjoyed this first group, and I'm going to be running it again in the fall. And so for those of you listening, if you're interested, you can go to my website, which is activebariatricnutrition.com, and you can join the wait list so that you get the first information as to when it'll be opening again.
Amazing. And best place to stay connected with you?
Yeah, I'm big on Instagram, which my handle is Active Bariatric, or you can certainly go to my website, activebariatricnutrition.com.
Thanks so much for your time today, and we'll make sure we follow you and stay strong with you and your active clients.
Appreciate that. Thank you so much for having me.
Thanks.
Bye.
Bye.